Hi, Steve Adler. Got a minute? All right. So if you're like one of those people that like joining me in the evenings because you like looking at charts and graphs, um, you've come to the right place tonight. There's going to be a lot of information and a lot of data. We had a city council meeting today. We were joined by Dr. Escott and Dr. Myers, who's the modeler. And I'm going to run through their presentations today so that you can see what the council saw. But before we do that, let's hit the numbers and the data first. The number of hospitalizations, we're going to start there, is 66. That's down at 66. Yesterday we were at 67. Day before that we were at 73. The 7-day moving average is at 71.6. Yesterday our 7-day moving average was 75.1. So we're down 3.5 from where we were yesterday. It's the first time in a while that number has moved in that direction. Still, 70 is of pretty significant concern. As you recall, somewhere between 70 and 123, we need to consider moving into the red zone. But moving into the red zone and where we are, 70 to 123 depends on what our acceleration is. As you recall, in mid-June, we alerted the community to the fact that we were just streaming forward. We needed to change that trajectory, maybe to give us a little bit more time. So we started talking to the community. People started changing behaviors a little bit in June. Just by way of spoiler alert, I think what you're going to hear is that we're not ready to say we need to move into the red zone quite yet. We bought a little time to get a few more days in data. We'll talk about that in just a second, but we are precariously close. This is not the time to take the foot off the brake. We still need to keep our foot on the brake. We still need the same discipline. We need people wearing masks and social distancing and avoiding big groups, staying home as much as we can. And I'll show you the data, and we can see why. But 66 new hospitalizations, 71.6 is the 7-day running average. On the other side, number of new cases, 703, significantly higher than our 7-day average, which is 453 or 452.7. Today 703. Yesterday we were at 753 in new cases. We're still trying to figure out what that really means. Because there's been such a delay at the labs in getting testing results back, some of those 703 and yesterday's 750 were tests that were given literally almost 10 days ago. And we don't get the results back for today. So this higher number may be that we're seeing new cases following from July 4th weekend, maybe that it shows that new cases while the trajectory was still higher from 10 days ago. And it's that level of uncertainty right now in working with these numbers, which is one of the reasons why we need everybody to stay absolutely as disciplined as they possibly can. The numbers that are in the middle, I'm told that's neither blue nor green. Those colors are mint. So now looking at the mint colors, the 7-day running average for hospitalizations is 447. The number of people actually in our hospitals tonight is at 440. So roughly the 7-day average. ICU 7-day average 145. The numbers of folks actually in our ICU 132. So that number has come down. 7-day average on ventilators is 76, but we have 91 people tonight on ventilators. So the ventilators rising at a higher rate than the 7-day average. 703 new cases. That's a doubling time of 25.2. We'll talk about that information and data in just a second. Why don't you go to the next page, Anita? Just so that you can see also on the website, those number of new cases today, the 703 gets us up to 13,864 cases. The number of people passed away, same number as yesterday, so no one new passed away. And the numbers in green we went over a second ago, those are the daily numbers. The numbers that were the mint numbers were the 7-day running average. All right, let's talk about what we learned today from the modelers, and let's begin with the presentation from Dr. Myers, the modeler that's been working with us, University of Texas. She's been incredible, and the fact that we had here locally perhaps the most renowned national modeler of pandemics is one of the reasons why we like living in the same city as the University of Texas. But Anita will pull up her chart as soon as she's able to do that, and we'll go through Dr. Myers' presentation. So here it is. Skip to the next slide. That's good. Why don't you skip to the next slide? All right, so this was the situation update. The first one of those graphs to the left side is looking at the R0 score. The R0 score, as you'll recall, tells us how fast the infection is being passed, the frequency it's being passed in our city. We know that an R0 of 1 means that if one person has it, odds are they're going to give it to one other person. If it's higher than that, if it's 2, then someone who has it is expected to give it to 2 people. If that's happening, the virus is increasing and spreading. If it's below 1 and one person gives it to half person, then eventually it's going to die off, because with each passing, it's going to fewer and fewer people. You can see on this chart that before we started taking actions way back in March, our R0 score was pretty high, and everybody who had the virus was giving it to multiple numbers of people. You can see as we did the shelter in place in April and May, we actually got our R0 score lower than 1, which is why we were tamping down the virus and it wasn't passing. You can see that sometime in about mid-May, there was an increase in the passing of the virus. In the EPI chart that we looked at a couple of days ago, that seems to be about the same time that we moved from phase 1 to phase 2 of the economic reopening. You can see that in June, we then continued to have the upward peak. That second upward peak probably reflects Memorial Day. Right after that is when we started putting the alarm out to the city and saying, hey, we're on a trajectory that's way too high. We first enforced a masking ban at businesses, required people to wear masks, and the numbers started coming back down. Part of that is not the policy. Part of it is just you and the community. Everybody's just being more cautious than they were before, more disciplined, and you can see the number has continued to go down. And we're flirting right now, perhaps, at an R0 of 1. Anything above 1, which is probably where we are right now, the virus is going to continue to grow. But those behaviors have been good, but we need to increase them and do a better job, and then so we can dip down below that number 1. The chart on the right is the doubling time. That tells you how fast the virus is doubling. You can see that at the beginning of June, the virus was doubling every 20 days. But as we started, it was actually, we were at one point up at 40. It was taking 40 days for it to double. So it's starting to speed up, getting to 20, but then going all the way down as we get into June. The virus is doubling in our community once every 10 days, once every 9 days. But you can see behavior starting about June 22nd when we did the mask ordinance. You can see that the numbers started going back up again. And we saw earlier on the dashboard that it's doubling like once every 25 days. So that just shows you we want to continue that number to the right to continue to move further and further upward to the right and increase the doubling. Let's go to the next page from Dr. Myers' reports. This is a chart that you've seen before. This shows the number of hospitalizations, daily admissions. That red line that crosses is 70. That's the point at which we need to really be taking a look. And that's about where we are right now. This does not have the number from last night or from tonight where we dropped back down to 71 as the 75 number that's in there. Those red lines that are moving up from the lower left up to toward the upper right, those are actually red dots. Those are the actual numbers. Stops here on yesterday's data. You can see the spaghetti lines that are gray. Those are all the different possible outcomes and different projections that we can have. But you can see with that red line, it's starting to flatten out a little bit, or at least not go up the same kind of projection that it was. But you can still see that if we don't keep our foot on the brake, this number could easily turn back up to a more straight up and down line. And in any event, until we start actually tamping down the virus, taking that R naught below 1, it's going to continue to show the increases that we see. So we are not out of the woods. We are still pretty precarious, and everybody is waiting to see what we have. Now, daily admissions, as you recall, is a lagging indicator. So the tapering off of admissions that we're seeing today probably reflects behaviors from 2 weeks ago. What we're going to see the remainder of this week and into next week are the admissions that correspond to the behaviors that we've had then, 2 weeks prior to that. And my hope is that, and the early indications are that maybe we're seeing a change in that trajectory such that we don't have to go to the red zone quite as fast as we might have otherwise. Why don't you go on to the next page? This tracks not daily admissions, but total admissions in the hospitals. As you recall, we're at 440 hospitalized right now. As that number continues to move, plus the numbers, that's the total number of people in the hospitals. The red lines or the red dots are the actual numbers, and you can see how that moves. Our capacity is somewhere around 1,500. But that's going to require us to get some help from the state or otherwise with respect to doctors and nurses. So we're checking now to make sure that we're actually going to be able to staff to the physical capacity that we have. If we can't be assured we're going to be able to get the staff, then again, we're precariously positioned and might have to do stuff that's significantly more restricted than what we're doing right now. Again, we remain on the edge with a lot of uncertainty as to what it is that can happen next. Why don't you go to the next slide? This shows the same kind of chart, but focusing this time on ICU beds. The range for ICU beds is somewhere between 340 and in the low 500s. The difference between those two is the staffing. We know we have enough staffing to be able to do the 350 beds in the physical place. We don't know, while we have physical capability, we don't know yet about the staffing that would enable us to get up to the 500. That's why that's in that red zone. And again, you can see how the lines are moving. Remember, we're going to have to change behaviors before we get to the red zone. Because if we wait till we get to the red zone, the line's going to continue to go up for another 2 weeks before we can change it, because things get baked in 2 weeks before we take the action. But what that line is showing us is that it moves a little bit farther to the right as it moves up, which means it's slowing down perhaps, which gives us a few more days to get a little bit more data and information before we have to make decisions. And that was the conclusion today of the experts, that we have a little bit more time. Dr. Escott is recommending that the behavior we exhibit right now is close to where we were in phase 1. Phase one of the governor's reopening is kind of what we're doing now, except that restaurants and retail was at 25% occupancy. So we're urging people to tamp down on your restaurant use and your retail use until we can get a better handle on what's happening with the virus. And we're asking the governor to consider moving us to a stage one. So that we can better protect ourselves from the surge, and based on the evidence we saw when we moved from phase one to phase two, that's when we started seeing the numbers rise. The city council took some action today. The governor's order and our order are aligned. The council today enacted two ordinances that provide additional ways to enforce the orders. Doesn't change our orders from being aligned with the governor's order. It gives us an additional way to enforce it. I got a letter from the governor last night supporting and endorsing us doing everything we can to enforce his order, which is consistent with the order, or our order is consistent with his order. One of those actions that we passed today would allow the city to enjoin the use of a property if somebody was using it in contravention to the orders. Would require us to go to court, but it uses our nuisance powers. And the other ordinance enabled Dr. Escott, our health official, to establish rules. And it gives those the force of law and enables the city to levy a fine up to $2,000 if somebody violates the rules from Dr. Escott. On Tuesday, he'll issue his rules, and I would anticipate they're going to be consistent with the orders that I have in place and consistent with the governor's order. But each of those just give us a different vehicle to enforce, because right now, because we're on this critical edge, we need to be doing everything we can to have the discipline. We will not be able to enforce our way to compliance. There aren't enough police officers or deputy sheriffs. You've heard me say it before, not enough firefighters. This is something that we have to expect of one another. You go into a room, 75% of the people are not wearing masks. You probably don't put yours on. You're walking down the street and everybody else has masks on. You're probably more inclined to put one on yourself. That's the behavior that we want to exhibit. So I also asked Dr. Myers to talk to us about schools. What's going to happen if she could look forward to see where we were and where we might be in August. So she gave us a chart that gives us something else to take a look at. The three graphs on this chart show you what the infectivity level is in our city right now, and how many people you would expect to see infected if someone went to school today. Those three different colors, green, orange, and purple, reflect a school size of 100, 500, and 1,000. And you can see that in a school with 1,000 people in it, if we opened it up tomorrow, about 8 people in that school or so would be coming into school infected. Numbers smaller for 500, maybe 4 people. If it's a 100 school, maybe it's a person. If we get to August 18 and we continue along the same trajectory that we have been on, measured mostly by the behaviors we saw 10 days ago, modified a little bit by the mobility information that we've seen over the last 10 days, you can see that that's where we would be in terms of the number of people we would expect to see showing up on a campus of 1,000 people. That would carry with them the infection from the virus. You can see that it is a number probably north of 35. School 500, about 18. And a school of 100, you're looking at a number that's probably about 3. So the question that I asked the modeler was, because I was asked that question from the community, could the community do something prophylactically that would decrease the number of infections as schools would open, that might increase the sustainability of schools being open, So she modeled what would happen is if we went to a shelter in place like we had back in March and April, and we did it now, we did it for 35 days. You can see if we did that and then came out on August 18th, the number of people that would be infected in that school of 1,000, it looks like it would be probably about 5. So I just wanted to get this information out to the public, to the decision makers. One of the council members today, one of my colleagues, Council Member Tovo and Council Member Poole, talked about maybe trying to set up a forum to get the modelers out and be able to answer questions for parents about schools. The modelers are available and have spoken with school administrators just to try to get information and data out. What you saw on this board with 35 days was not a recommendation or a plan. It was just answering a question so that you could see how the data works. All right, let's then talk to the next slides that came from Dr. Escott. We'll go through those quickly. These look more like the slides that you normally see, but I want you to be able to see them. You go to the next slide. This is the one that shows us new confirmed cases. That's the 7-day average. You can see that we peaked in mid-June, and now the number's starting to come down. That's the 7-day running average in yellow. That's new cases. This is not the most reliable number because we don't really know if what we're seeing from the last day or 2 or 3, because one, we're not testing everybody, and also because some of the tests that are coming in now were taken actually 10 days ago. That's why we focus on hospitalizations rather than cases. Why don't you go to the next chart? The next chart shows you doubling times. We talked about the doubling times and how we were getting to 25. This next chart shows you in yellow that our doubling time was up, as we said earlier, about 40, it didn't double, but every 40 days. Started to head back down. We got close to 10. It was doubling every 10 days. Now we're back up to 25. That's what that yellow chart shows you. The next page is admissions. And as we know, admissions started going up real precipitously, almost getting closer to straight up and down. But here recently, it looks like it's still moving up, which is why we still need to focus on what we're doing, but maybe not moving up as quickly as it was before. The next chart that we have is the one that shows you hospitalizations in blue, admissions that's in blue. The ICU admissions is in orange, and the gray is the ventilator use. And we're taking a look at those numbers that all seem to indicate, except for ventilators, that they may be stopping the trajectory. Ventilators, the trajectory is increasing. Makes sense. That's the most lagging of all the indicators we see. Turn to the next page. This is the page that shows us the ethnicity and race of people that have been hospitalized. The number at the top is the Hispanic community. You can see that 57.6% for the last 7 days of folks hospitalized. Hispanic, significantly higher than the 37 or so percent, 38% that Hispanics represent in our community. That's the disproportionality. Whites are in blue, below that in, violet, purple. African Americans, over 10% of hospitalizations. That also is substantially higher than that, the Black percentage in our community. Okay, if you turn to the next slide, this tracks age group and a lot of lines on there. But what we've seen is that the increase in age is going to a younger group. Let's go to the next slide because I have a better one to show age here in just a second. Public testing is the next slide. This is from a week ago. This is not all testing in the city. It's not community care. It's not the ones that are happening at CVS and Walgreens or other kinds of stores. This is Austin Public Health, so it's a limited group. But what it shows you is that for Austin Public Health testing, 9.6% of the people tested are showing up positive. That's the overall number to the left. You can see in Hispanic community up to the right, 15.2% of everyone being tested is showing up as a positive number. The green lines show you the total number of tests that are given in those areas. Infectivity rate among Asian Americans, 5.9%, and African Americans, 11.7%. Go to the next slide, you'll see what those same numbers are for this week. And you can see that we've given out substantially more tests this week than we did the week before. That the Hispanic percentage is down, but still much higher than it is for the white community. The African American percentage now is the highest at 12.9%. Both these communities of color are the ones that are most susceptible and showing the greatest disproportionality in our community. You go to the next slide. This is the one that talks to us about age, and you can see that new cases by age here in the first week of July show a lot more people in the 30 to 39 range. We're showing a lot more young people showing up in our hospitals and a lot more young people showing up in our intensive care units. Folks are not spared from this virus by age. And my concern also is that even if a lot of these young folks don't end up in the hospital, I'm real concerned about the number of people that they're going to infect. Just because there are so many of them that are showing up positive, I'm afraid that they'll be near someone else who ends up hugging their grandmother. So when someone gets it at a younger age, it's not just the risk they face, it's the risk that they present to the community generally and at large. We continue to track the clusters in the city and the nursing homes. We have one more nursing home that's come out this week with significantly high numbers. So we have strike teams. I think 2 strike teams headed to nursing homes as we speak now to try to tamp down situation. Well, anyhow, those are the numbers that we had that I wanted to go through with everybody. We're doing this on a day-by-day basis. The net result was that not a need for us to declare going into or asking the governor to immediately order us into a shelter in place. We still have the opportunity to see a little bit more of the data. We need people to show even more discipline than they've been showing in order to be able to bend those curves if we're not going to reach the place. We're going to be taking another look at these same questions early next week, Monday, Tuesday, Wednesday, to see if they change. I'll continue to present the numbers to you. Please, everybody stay disciplined, wear masks. Just wear masks. Keep the social distancing, stay at home if you can. Don't go out if you feel at all sick. While we're together, I want to point out to you, tomorrow is the last day of early voting. It's going to be a lot fewer people there voting tomorrow. If you haven't voted yet, go vote. Early voting, they do it in a way that's real safe. People are separated. They even have a little kind of like balloon that goes on your finger. So when you touch something, you're not going to actually touch a surface. I voted. It feels very as safe as it could be. I wish we had mail-in voting. That would have been better. I urge everybody to vote. If you can't vote tomorrow, then Tuesday is the election for everybody to vote. Smaller crowds tomorrow. You can go vote tomorrow. We have posted Austin Public Health a kind of strategic plan in dealing with the outbreak in the Latinx community. I'm going to show you a banner here today. We're looking for input, especially from folks in the Latinx community, but certainly anybody in the city can participate. Austin Public Health is going to take all that information and then present it, finalize the plan so that we can deal with that challenge. But we need the expertise and the insight that comes from folks in the community, so please participate. I want to remind you that Austin Public Health is hosting a multilingual community conversation this weekend. It is 10 o'clock on Saturday, July 11th. It's free. There's going to be translators to interpret English, Spanish, Arabic, Burmese, Vietnamese. To register, please go to this banner. There's going to be an opportunity for two people who spoke foreign languages to be able to speak to one another. Don't have that many opportunities to do that kind of thing. We need everybody's help. I want to remind you the census needs to be done so that we can get our money. If you haven't gone online to do the census, it takes just minutes. Please consider doing that. There's the banner. Census is critically important for us getting money to get healthy foods, to get the money we get to give food to folks in our community. It's all dependent on the census numbers. And we need to do better. And with that, I want to talk about the grab bag this evening, mailbag, and then I'll let you all go. As parents, grandparents, we're all wondering how it is that our children are feeling and what they're thinking. We have a kindergartner, Leah. She want to introduce you to her. Here she is taking an online class while she is dressed as a polar bear, which makes absolutely perfect sense to me. Leah did some art tonight that we're going to talk about. She calls this piece "What is in my heart." I love this piece because it's beautiful and it's colorful. I love that Leah is able to convey what she's thinking and she's feeling. I especially love this piece of art because it looks like a chart to me, and you know how much I love charts. But all these beautiful colors, they each have a meaning. There's a legend in the bottom corner. To let us know what is happy and what's sad, what's scared. I just really appreciate this, Lee. I appreciate you sharing it with us tonight. And with that, sorry to have talked through about so many numbers. Stay disciplined. We are in crunch time right now. And I will also tell you that we are now learning that not only do we have to do everything we can to help keep our hospitals and ICUs from being overwhelmed with what's happening here, there are cities to the south of us that don't have room in their hospitals right now that are now reaching out to us to give them assistance and help. And it's going to happen more and more. This is a situation that all of Texas is facing and struggling with all at the same time. We are all in this together. We are all at crunch time together right now. Good night and be safe.